I'm Nadia Bilchik. This is Nadia Speaks. And today I am honored to be joined by the three Doctors Bilchik. So that is Dr. Tanya Bilchik, who is a neurologist living in New Haven, Connecticut. It's Dr. Anton Bilchik, who is a cancer surgeon living in Los Angeles. And then we have Dr. Brian Bilchik, who is living in Boston. And then you see a picture of Troy Johnson, who is going to be our engineer for the show. And we are doing a show on how has COVID-19 impacted the three Doctors Bilchik. So let's start with you, Dr. Anton Bilchik. You're in Los Angeles. As a surgeon, how has COVID-19 impacted you, your practice, and your life?
It's impacted my life in a very big way, in the sense that all our elective cancer operations have been canceled. We're only operating on patients with emergencies. It's extremely challenging as a cancer surgeon to cancel cancer operations in patients whose lives may be impacted. And I think delaying an operation by a week or two probably makes no difference with certain cancers. But since we really don't know at what point it's going to be safe for patients to come into the hospital, and also safe for personnel or hospital staff to be around these patients, it leaves us in a very precarious position, because it's clearly not in cancer patients' best interest to wait too long if in fact they need surgery. So this is an ongoing issue, an ongoing debate. Now, things are different from state to state. We've all heard about the so-called curve potentially plateauing in certain states, and we're trying to figure out how that may impact us, in particular, at what point it would be safe to go ahead with certain operations, since if in fact the hospitals reach a point where they're not at capacity and can in fact allow us to operate on these patients, then some consideration should be given to moving forward. But we really are in a very difficult predicament right now, and as a surgeon who not only operates on patients but also takes care of sick patients, we're being asked to potentially be deployed into areas where there are COVID patients and there's a need for additional physicians. So we are in a waiting mode, which is particularly difficult for us, and we all hope that this is all gonna be over soon.
So for Tanya, for you, Dr. Tanya Bilchik, my sister, the neurologist, other than working from home, or how much do you work from your office? Tell us how it's impacted you personally.
Well, I'm actually purely outpatient, so I do not do any hospital, and I haven't done any hospital since 2008. And so I have outpatient patients. So I've actually been able to do all of my follow-up visits either by the phone or as teleneurology visits. My procedures, I still do. I go into the office, I put on a mask, I put on goggles, I put on a visor and gloves and a gown, and I still do my procedures in the office, because I consider my procedures that I do for my headache patients pretty much like medicine. And so if they don't take their medication, in other words, if they don't get their procedures for their headaches, they're going to be in trouble. And my goal is to keep everybody out of the emergency room, myself included. And so I only do outpatient. So I haven't been drafted into any of the hospital systems. And I haven't done general neurology since 2008. And I haven't done medicine since internal medicine or hospital care since the early 1990s. So it's I don't have that qualification.
Yeah. Right, but you are still seeing people who are really, really needing your help.
And I'm also putting masks on my patients before they come into the office, and we're checking their temperatures.
Okay, then we have Dr. Brian Bilchik, who is my brother living in Boston. Brian, as a cardiologist, how are you managing this? How has COVID-19 put you into a different space, literally and figuratively?
So first of all, thank you so much for inviting me to be your sibling on this show, and it's kind of fun to see my siblings here in their professional roles and kind of a different environment. Anything to make our days a little brighter right now. You know, the whole environment for us is rather surreal. This impending storm that is occurring, and it's approaching fairly quickly. So the goals, being a cardiologist is, you know, it's been a pretty intense preparation stage. First of all, learning as much as we can about the virus and the way it affects people, and the way we can manage them, you know, is incredibly important. And I've never seen so much academic literature coming out so quickly. And it's wonderful for me to be part of an institution that is working on a lot of the trials, looking at therapies, testing. You know, my position has been rather stressful, running an outpatient academic practice, dealing with cancellation of all elective procedures, as Anton just mentioned as well, which includes all of our ability to do outpatient testing and keeping people out of trouble. So it's been a tremendous transition for us, and managing people who can't come to work, and do we keep them employed and on the payroll, and all the different logistic, academic, but also administrative issues and challenges about, you know, making payroll, applying for loans. The government keeps changing the rules. There are all these disaster loans. And it's been a challenge to figure out what the best strategy is when you're taking care of people, trying to learn new languages, and transition to a virtual care system. So we used to have patients in the office in a pretty dynamic way, and 90% of what I do is in the outpatient setting. And transitioning to virtual care and telephone medicine has been quite a stress, trying to figure out how to document for it, how to be reimbursed for it, and most importantly, how we can be helpful for our patients, keep them out of the hospitals. You know, and again, cardiac situations aren't always elective. So the challenge for us is to keep people who are elective or seeing us on an elective way, keeping them up with their appointments, but also dealing with all the urgent things that come up with our hands cuffed, so that we can't necessarily do all the things and the investigations and the treatments that we would like to do.
Clearly, for everybody, this is totally unprecedented. It was unexpected. We had not planned for it. When you think about each of your different practices going forward, I'm just curious again, and I'll go the same, Anton, then Tanya, then Brian, is obviously this is a mind shift. How has it shifted you, and what do you think is going to be the long-term impact on surgery, on surgical oncology?
Well, you know, Brian alluded to something interesting, and that is that there is an enormous amount of data that's being captured. And I think that fundamentally this may change the way we approach patients, the way we approach medicine. You know, telemedicine has been around for a long time, but it certainly hasn't been utilized to the extent that it is now. I think that the last couple of years there's been a big focus on value-based care, which quite simply put is how can we improve quality and reduce cost. I think it's very clear now that we're in a recession, that unemployment is at an all-time high. Even when this pandemic ends, a lot of people are going to be without healthcare insurance, and so we really are going to have to not only change the way we're practicing now, but change the way we practice in the future, really to try and accommodate patients' needs in the most cost-effective way. And certainly from a data standpoint, and again, this is going back to being a cancer surgeon, I think that we're going to learn a lot in terms of which cancers need to be operated on within a certain time frame, which cancers can perhaps wait, when it's more beneficial to treat with chemotherapy or radiation up front. So I think that this is absolutely going to change the way we practice in the future. And I mean, part of it is a personal struggle as well. Just seeing patients, and this is now across the country, patients that are in the hospital that are unable to be around family members, patients that need to see their doctors, whether it's a cardiologist, a neurologist, or a cancer surgeon, and they're very anxious. Often patients will come in with a family member. Now, hospitals around the country are discouraging any other visitors to come with patients, or discourage visitors to the hospital in general. So it's taking a big emotional toll, both on us as physicians, but also on our patients.
And for you, has that had any impact? Do you see yourself doing more telemedicine?
Actually, that's a very interesting point. And in fact, I think I'm going to put a positive spin on all of this. The positive spin is I'm in Connecticut. I have a lot of patients that go to Florida over the winter, and for 4 or 5 months, I can't see them. Now that we've actually rolled out telemedicine, I can do follow-up appointments with those patients and see them and catch up with them. I have a group of younger patients that are all in college. Same story. I don't get to see them unless they're home on spring break, winter break, or over the summer. And so I'll be able to keep an eye on them while they're at college as well. So the positive spin of all of this is we've now rolled out telemedicine. We never had telemedicine in our practice or in our organization, and we've rolled it out properly. We've got secure networks. We have a very nice way of making appointments. The whole practice has become involved in the whole tele headache world. And so it's something that we're going to be able to follow through with follow-up visits and possibly even consultation visits for patients in an area that are underserved.
So out of crisis comes opportunity, right? Out of crisis,
exactly.
Yes.
Exactly.
That's interesting. You know, always
they give you lemons, make lemonade.
Make lemonade, made limoncello. Brian, for you, I mean, I'm just so curious about how we're all adapting and pivoting, and how you see this, which you must have thought about as someone who's heading a practice.
Yeah, it affects all levels of the personnel. And I was just on a conference call a little earlier with my medical student, one of my medical students who rotates with me, and Harvard Medical School has sent all the non-clinical medical students or the preclinical medical students home. So he's actually learning virtually from California. And medical students have been marginalized in hospitals because there's not enough protection. So they've been sent home unless they can serve some sort of clinical purpose. And the stress for the medical students, for those learning, has been incredible. It's changed the way they're learning and our ability to teach. It affects our nursing staff and their ability to do procedures and come into contact with patients. You know, the saddest thing for me is the lack of protection gear that there is for the people who are on the front line, who are truly putting themselves at risk. And when I talk to the emergency room physicians who are about to admit one of my patients who has cardiac issues, but also a fever. And they tell me that they've been wearing the same mask for the last week. They have to take it home, sterilize it, bring it back. That they're putting themselves at tremendous risk without the right gear is probably the most devastating thing that I have to deal with. What Anton alluded to of patients being alone now, and we all practice medicine in South Africa and studied in South Africa, where there was tremendous rationing of care. And we were involved in very difficult decision making at that time about who would be, we were triaging who would be eligible to be in an ICU, who would get a ventilator. And for people who have never seen that, when there's unlimited access to, care here, it's very challenging for clinicians who are making difficult decisions, and in an environment where the family is not allowed to be present, is just tragic. So there's just so many. It has impacted, not only our professional lives, but our personal lives, and getting home and washing and showering, getting rid of the clothes before we get in the house, and then, heading off to work. And, work has been incredibly stressful. There's no downtime while you're at work. The days seem to go by really fast, but at the same time, they're exhausting because there's so much information and care and, all the levels of things you have to take care of. So it has affected each and every person that we touch or are involved with, from the medical students to the attendings and to our personal families.
So each one of my siblings on this call, Tanya, Anton, and Brian, are all physicians and all extraordinarily fit themselves. So I want to transition this part of the conversation and say, we all know that COVID-19 is a great leveler. It doesn't matter what age you are. Well, no, that's not totally true. Older people are at greater risk. But one of the things we are hearing is people who are healthier, who have a stronger immune system, and this is what we're understanding, seem to cope better with the virus, and in so many ways, it's serving them well. We are talking about elderly people at risk. I know age groups, demographics, but come each of you, if we are going to bolster our immune systems, and if we are going to be as resilient as we can during this pandemic, Brian, we have to start with you.
Yeah, so, I think the charge that I have, and this is what I say to every one of my patients who I speak to, is, my job right now is exceptionally difficult. I can't do what I normally do, but I have to keep people healthy and out of the hospital. And how do we do that? How do we manage healthy behaviors? And in fact, talking about my medical student, I just created a project for him. So he's going to be talking to the patients that I speak to on a daily basis, and he's going to assess what are their activities that they're doing to stay healthy and fit, and they're going to, and he's going to report back into creative ways that people are exercising. The other piece is, how do you eat healthfully when you're buying stuff that has a long shelf life? And generally, things with long shelf lives have a lot of sodium, and so people are changing the way they're eating and cooking. So the accessibility to healthy and fresh foods, not so easy, especially when you don't want to, go to expose yourself to the supermarket. And certainly in Boston, trying to get food delivered, there's a 2 to 4 week wait for fresh food to be delivered. So delivery services are at capacity. So there are ways to do it. And I think, the investment in health and physical activity. And, I take care of a lot of patients who are actually physicians and clinicians. And, the importance for each of us to exercise and look at kind of creative ways of exercise is essential. And, here's where technology has really been very helpful for our own personal ability to exercise, using health apps, physical activity apps at the home, but we can, because we have to, and we have access to that. But many people, we have to look at other creative ways of staying healthy and exercising and eating enough, and certainly drinking enough fluids.
And Tanya, I know you say headache, that change and stress often can cause headaches. Just any advice to anybody who's watching this saying, I am suffering from a headache and I don't have easy access to a Dr. Tanya Bilchik?
Well, actually, migraine brains do not like change. So just because you're home doesn't mean you sleep late. Just because you're home doesn't mean you watch television until midnight. Keep a routine. So, I used to have patients, I still have patients that can't understand why on a Saturday morning they get more headaches than they do during the week. And I go, okay, are you sleeping later? Are you having more coffee, less coffee, etc.? So don't change your routine. Eat breakfast, exercise regularly, stay hydrated. All the things that I talk about, keep your stress level down. A lot of this is just common sense.
Yes, but just because it's common sense doesn't mean we apply it commonly. That's
well,
very
you
helpful.
got to do it. A lot of people are home and working from home, so they don't realize how stressed they actually are at home, because not only are they working from home on their computers and on their screens, but they also have kids at home, and suddenly they're becoming teacher mom instead of doctor mom or other mom, and so it's added stress. So take the kids out, make sure you go walk, go make exercise, do whatever. Just don't skip your meals and don't eat junk just because you're home.
The headache brain does not like change. I learned something there today. Dr. Anton Bilchik from Los Angeles, California. Tips, advice, guidance on how we are going to bolster our immune systems.
Well, clearly there's two forms of health. There's physical health and psychological health, and both have been discussed. There are a lot of common themes between heart disease and cancer prevention. It's well known that exercise reduces the chance of getting cancer, reduces the chance of getting heart disease. Exercise doesn't have to be lifting heavy weights every day. 30 minutes a day, 5 days a week of just cardiovascular or just walking is considered adequate for many people. But I think the psychological component is really important, and both Tanya and Brian alluded to that. We're fortunate in the medical profession in that we can talk to our peers. We constantly can share both the frustrations as well as how we see the positives that are going on. I mean, one thing to consider is, and that I've certainly seen, is that there's the camaraderie among the medical staff. Times like this is quite extraordinary. People say things that you would never believe that they would normally say. Little gifts, little notes, little points of encouragement. So I think that this, in many ways, has brought out the best in us, and we all look at each other as being on a team. Certainly in the area that I work, no is we just rarely hear that word. We all will help each other in every way that we possibly can, and so I think that this is making us really rethink the value of life, the value of our careers, the value of our profession. I think we're very fortunate to be physicians, and this is something that perhaps I've thought about more now than I ever have before, is just how much I do appreciate my profession. So I think it's important to try and stay healthy physically, but also mentally.
Anton, you said something to me in one of our conversations this weekend. You said never before have you almost felt that as a physician you were like in combat, that no physician is saying no if they are deployed somewhere, that there's this absolute sense, and you said it, camaraderie. You're on this team because the fact is the war is being fought right now, and it is the war of a very deadly virus.
Oh yeah, absolutely. Yeah, I mean we're constantly checking in with each other, whether I'm checking in with the intensive care unit staff, texting the intensivist, how are you doing? Can I help? The intensivist texting me back saying, so happy that you checked in, hope you're doing well. I mean, just these little interactions that go on. I've never seen such warmth and such camaraderie among my colleagues.
So finally, as we wrap this up, and I'm hoping we can have this conversation again next week at the exact same time to catch up and see where things are. And this time, perhaps, Brian, I'll start with you, which is whoever is watching this right now, in whatever country in the world, because we are all experiencing this globally. What is your overall message, both as a father, as a husband, as a physician, as a cardiologist, and as a global member? And I'm going to ask each one of you just final thoughts. What would you like to say to all of us who are in this together?
Wow. Yeah, I don't think any of us have ever experienced anything that has affected every continent and every country and every corner. No one's immune to this. I think we have to take care of each other and take care of ourselves. We have to be appreciative and grateful for what we have and the care that we get. I am so impressed by the gratitude that patients have been expressing, that they are still able to
have access
to their doctors. But everyone talks about the social distancing, the physical distancing. That's essential. We have to be prepared, and we have to listen to science, and we have to recognize how important the data is, and learn from our mistakes and move forward, and take care of each other and take care of ourselves. And I always say this to my patients: you can't take care of anyone else unless you take care of yourself. Mm-hmm. And we got to stay healthy so that we're not causing a surge in the medical system, because right now this medical system is in a serious crisis, and it could crash before it gets better. So I think it's day by day.
Day by day. Tan?
I am of the same opinion as Brian. You really have to try and prevent the spread. Unfortunately, we do not have universal testing for people that are not symptomatic. We're not there yet. So the only way to work on prevention is to keep everybody apart. Have your own little pod. At the moment, my little pod consists of my husband, myself, and one of my kids is home. One of my sons is at college at Brown in Providence. They have their own little pod of 10 of them. They're not allowed anybody else in the pod. They're not allowing anybody else to contact or be part of that. They are all keeping safe within their own pod. And I think that's really important, is to keep away from as many people as you can to keep everyone safe, because there are asymptomatic carriers. Probably a fifth to a quarter of people are asymptomatic. We don't know whether we're symptomatic or asymptomatic, and I think that's part of the problem. There's no test. There's no test that, when I joined a big organization, which I'm part of, they screened us all for TB. They screened us all for measles, mumps, and rubella, and hepatitis. Well, nobody's screening, so we can't really tell. Once there is a screening test, I think that will really help. And a vaccine would be even better.
Let's say amen to that. Anton.
Well, I was just going to say that neurologists and cardiologists are so much smarter than surgeons. And I couldn't have put it any other way other than reset, reflect, and be appreciative.
On that beautiful note, we have made history here. Me doing an interview with my beautiful brothers and my beautiful sister, all physicians, all dealing in their own different ways with this virus, with this pandemic. And my wish to every single person who's watching this is that you listen to people's advice. And I like what Tanya said earlier, you create lemonade out of lemons, which is easier said than done. But just to share with you all, my silver lining in this is that I get to spend, and I just did, 40 minutes with my brothers and my sister in an unprecedented way. So wishing everybody sanity, safety, and strength. And I look forward to a catch up with the 3 Doctors Bilchik next week.